Charlie came around the corner. The hell he's clean. The cap to the.
Okay, I'm doing this video to demonstrate how to get a wound culture. Before I'd even come into the room, I would of course check the orders, come in and then check his hospital bracelet, get his name, date of birth, ask him for all that. I would ask if he has any allergies that I don't know about. And then I would want to do a pain assessment, like what is your pain? 0 being no pain at all, and 10 being the most pain you've ever had. And then hopefully he's at a 0. And then after that, the first thing we want to do is, I'm going to make sure the bed is, raised up safely, and then practice my general practices and safety measures. Yes. General something. What is it? What is it? I'm going to practice my general principles and safety practice. When I get into the room and raise the bed up safely, before I would even come in here, I would check my order and make sure this is what I'm doing. I'm getting a wound culture. I would go into the room and ask him for his name and date of birth, and then I would check the bracelet to make sure that is accurate. I would ask, do you have any allergies that you don't know about? And then I would also ask, or I would get a pain assessment on him, like, what is your pain level? From 0 to 10, a 0 being no pain at all, and 10 being the most pain you've ever had, and hopefully that would be at a 0. And then after I get all that, his bed's lifted, everything's good, I would do hand hygiene.
Yes, that's for this.
I put gloves on. And I've already got all of my equipment here to do the wound culture.
You don't have to do it. You don't have to do it. You want sterile. You have to do an assessment on one of the stitches.
Okay. So then what I'm going to do is I'm going to expose the wound. I'm going to bring this down. We want to start from the outside and just start carefully removing the tape from the skin. Once we get it off, we want to examine it and make sure there's no, not an excessive amount of drainage or nothing that looks like infection or anything like that. We just kind of want to do an examination of what drainage is on the pad, and then you want to throw it away. After that, I would straight go and do more. I would take my gloves off, do more hand hygiene, and change my gloves. But just for the purpose of this video, so I don't have to change gloves 500 times. I want to keep them on. But I would do my hand hygiene, change my gloves. And the next thing I want to do is irrigate the wound, make sure it's clean. We'll bring this in here for any extra, and we would just go through and wash it with saline really good and make sure that that it's good and clean for a culture. And then after I got that clean off, I would maybe take a piece of gauze and then I would go around just the edges of it and make sure it's dry just around the edges, and then I would go ahead and do my hand hygiene again and change my gloves again. And then after I had my gloves changed again, then I would go in and get my swab. Oh, it's going to be really hard to open the gloves on. Alright, we got it.
We'll clean up before we leave, except for all that stuff.
Okay, so when I get my swab, I just want to go right around the middle of it and just try to get some of the,
That's why we can't have nice shit, bro.
try to get into the wound, maybe get some of the drainage out. We just want to make sure we have a good specimen here. And then I'm going to put it into the tube, and I want to be really careful not to touch the sides of the tube with the swab.
What is it?
Once I have the swab in, I'm going to make sure that I put my initials, the date, the patient's name, date of birth, and then the site that I got the collection from. And then after that, I would place it in a biohazard bag, which I don't have, just for,
So I said.
actually, hold on, there's one right here.
Color and odor, but I didn't.
We would put this in a biohazard bag, and it already has a label on it, and we would just send it on down to lab. I pour all that up. But then after that, I would, go ahead, I would rebandage this with a clean bandage. I would just rebandage it. I would want to put my initials and the time on the bandage. That way they know when I put it on there and that it's a new bandage. And then I would want to clean up my mess, throw away my trash. Make sure he has his call out, make sure the bed's down in the right position. I would ask him, make sure his pain is still at a level that it was when we started, at a 0. And if it's not, then of course I would want to take care of that. And then as long as he's good, then I would go out and report and record and evaluate.
Will you do me a favor? If I stand